This question probably is more related to Dr. Ko and Dr. Huang's discussion. And the question is, why do you, okay, before going into the question, I'd like to talk about a little bit that some medical staff, they don't really know technology. So they may resist every time when there is a new trend or a new technology coming in. So the question is, why do you think some people in the healthcare industry will resist or doubt the telemedicine model? And also, when you do the education and when you carry the treatment with your patient, do you have any tips or things that you can share with us?
After working like last 15 years in IT field, this is what I realized. What is IT? Yeah.
Sure, thank you.
So let's give a big hand to these student leaders to bring the training to you. Why don't you give them a big hand to them?
Yes. Okay. So in terms of trying to convince other healthcare providers to take on telemedicine, I think number one is really to make things simple for them. Yeah. So if your process of setting up telemedicine is going to be very, very tedious and too many steps, and it doesn't, you don't interface it well with your current system that you have, it's other people are not going to take it up. So it's important to make it easy for them to learn something new. With regards to convincing patients to come on with telehealth, again, you have to make the process simple. You have to make sure that it's secure, and you have to choose your patients correctly. So, like for us, we do not do for new patients at the moment. Of course, we're exploring that, but it takes time for the doctor and the patient to get comfortable. So, choose patients that are already very comfortable with your doctors. Follow-up patients that are very stable and they're there just to for reassurance sometimes. So I think it's important to choose the patients very well.
请黄教授也回答一下，谢谢。
我回答这个，我刚才说过了，我们远程医疗。
Okay, so I just mentioned that telemedicine is one of the models. So it still has to adhere to all our basic principles of giving out treatment. It has to be effective, it has to be accessible, and it has to be easy to use. Just now, Dr. Ko also mentioned that it can be very effective for the patients. He himself is a dermatologist, so in his territory, this is very easy to use platform for his patients. So I think, of course, it's just a model. In terms of the overall practice, he will still have to follow the practice that's stipulated by the hospital. And in terms of how to convince the patients, some people, they have this natural resist, but once they feel that they could rely on the doctor through this model or through this venue, once they build the confidence, then they'll be much more willing to accept this type of treatment style. And then I'm sure that once they see the effectiveness, once they see the convenience, they are able to accept it much better. So, for example, if we receive, a lot of time we will receive X-rays from our radiology department and from our sonographers, and we have to do a diagnosis on that. That is already one type of telemedicine, and it is effective because we can give diagnosis on that right away. So I think this is a mutual thing. We just have to make them feel that this is very effective. Thank you, Professor Huang and Dr. Ko's reply. But I think this is still just part of the question. That we are facing a lot of challenges. So, for example, Professor Huang is a specialist in imaging, and you give a very good example. But a lot of other areas, other disciplines, they may not have this type of know-how, or they don't have that training, or they are basically resist to new technologies. How do we then allow those doctors to get used to this style, or it's not just about learning remotely, but how do they get used to this style fundamentally? I think we'll go back to the doctor. Doctor is always, I think every doctor has to continuously learning. Continuously learning is the fundamental trait of any medical staff. So, for example, some of our medical colleagues, they may be very experienced in the clinical diagnosis, but when it comes to remote, they are not so familiar. So they have to know that sometimes it's not just about their own experience and their own diagnosis. With this technology, they're able to combine the diagnosis of many more parties. And if they have some doubts or some questions, we can even use some technologies in the APP to make it easy for them. So for example, just now, John also mentioned, like we can have a very human-centered interface. We can have some softwares that are much more easier to use. So I think once this hurdle is overcome, and I'm sure a lot of doctors is willing to try. And I think many doctors, it's just that they don't know how to do it. But once they know, they are very much willing to try this style of giving out treatment.
So,
do you have anything to add, Dr. Cole?
we are also starting a program to try to teach new doctors on how to take up telehealth and how to choose their patients with telehealth and what telehealth can help, in terms of their in the clinics and really help with the work with their patients. So I think it's important, to start thinking about educating our doctors on telehealth, even from medical school time. So I think it's going forwards in the next 10 years, telehealth is going to be really mainstream. So think about education in telehealth as well.
好的，谢谢徐教授。
Thank you.